again, it will go back to the mind-body connection. So chronic pain it's very common in cesarean section scars, adhesions on the scars. Speaking of chronic pain in other ways, I have seen women go into psychosis, into moments where their labor has repeated on them. They're feeling it again. I've actually had to call an ambulance for someone. I thought, oh my God, she looks like she's in labor. But she'd had a C-section and her body was reliving it.
Welcome to the Radical Health Rebel podcast. I'm your host, Lee Brandon. This work started for me several decades ago when I started to see the impact I could make on people, helping them to identify the root cause of their health problems that no doctor could figure out, including serious back, knee, shoulder and neck injuries, acne and eczema issues, severe gut health problems, even helping couples get pregnant after several IVF treatments had failed. And it really moves me to be able to help people in this way. And that is why I do what I do and why we have this show. Welcome to this week's episode of the podcast. Join me as I sit down with Nickita Starck, a visionary leader and advocate of holistic maternity care. In this episode, we delve into the impacts of an over-medicalised childbirth system on mothers and babies, discussing how it can lead to chronic pain and long-term health issues. Nickita shares her insights on the importance of informed choice advocacy and natural birthing practices in reshaping the landscape of maternity care. Don't miss this powerful discussion on the transformative initiative when push comes to shove and the vital role of empowering women in their birth journey. Nickita Starck, welcome to the Radical Health Rebel podcast. Thanks for coming on the show.
Thank you so much for having me.
Yeah, it's great to have you on, Nickita. So to kick things off, could you share with the audience your own journey and how you became so passionate about and an advocate for natural childbirth?
Yeah, I'll give it a go. I'll try and slam it all into a nutshell. Okay, so I'm Nickita and I am founder of a company called When Push Comes to Shove, which is, to my knowledge, the only decentralized maternity structure in the world. I started my journey into my passion of childbirth when I was just 21. I had my first daughter and it was an awful experience. I was totally traumatized by what happened to me. Yeah, just so much trauma. And I started to become a bit obsessed of how this happens to women. Why does this happen to women? And I was speaking to my grandmother. She'd had 7 children. And I said, Nanny, how have you done this when trauma is so normal? And she said something that would change my life forever. And it was so simple. She said, it's not normal, it's common. There's a difference. And that was it. I was obsessed learning more. Why had I come away feeling my body had failed me? And more to the point, why have I developed some sort of Stockholm syndrome for the people that did that to me? So I went down the road of the bog standard, training in midwifery. I really didn't like that. I left very quickly. It felt like a conveyor belt and it felt like women were being preached at and told what they can and can't do. The words, am I allowed, came up a lot and that disturbed me. Allowed what? It's your body, your choice. And I was alarmed at women wanting to hand over their birth, but I could understand why. I did the same thing. So I studied to become a doula. That didn't quite align with me either.
Can you explain what a doula is? There might be some people listening to this that don't know what a doula is.
Sure. A doula is a woman that provides practical and emotional support for a woman during pregnancy and birth and beyond. They're not there to provide clinical care. But I did like it, but the politics within the birth world, it was bizarre. It was very bitchy. It's really surreal. I thought, why is everyone so angry with each other? And then I started working with some women outside the system. I just stumbled across them. And then I met a partera, which is a traditional Mayan midwife. They can't read or write, but they know birth. I started to learn some ancient wisdom, some ancient techniques, understanding herbalism. indigenous wisdom from various cultures. And I was friends with a few independent midwives who were working outside the system, although still under the governing body of the NMC, the Nursing and Midwifery Council. And then I had another baby in 2020. And I thought, I don't want this system involved at all. I had a really incredible birth. It changed everything. It was like my daughter introduced me to me, like another piece of the puzzle. And then with all the insanity that ensued in 2020, independent midwives lost their insurance. And I thought, oh no, that's women's last chance of autonomy. So I started when push comes to shove, but I didn't start it as it is now. It was just to raise awareness. And I'm also a singer-songwriter, and I wrote a song called Breathe Again, just to spread awareness that women do have a choice. And I worked with my late mentor who died last year. Her name was Beverly Beech, and she wrote a book called Am I Allowed?, which I'm now writing the 5th edition for. I'm really nervous about that, but I'm excited too. And a few years later, here we are. So I've trained about 140 women to do what I do. There wasn't really a name for it, but it's getting around now. And I have my doula course. So it's like a 6-week course to train women who want to have like an introductory education into childbirth. But I've also since co-founded a company called Artemis Academy with my colleague Angela Chamberlain, and she's an award-winning midwife. And now we have like a year's course to become a birth keeper. So it's not just about childbirth. There's so many layers. I always say that birth education alone is not enough. We have to go deep. We have to see our core wounds. We need to cut this generational trauma, the ancestral trauma, and understand your health as a whole, mind, body, and soul, and understanding nutrition, human rights, navigating the system, medical ethics. It's all there. And we've got about 20 guest speakers, experts in their field, from female genital mutilation to nutrition, medical ethics, homeopathy, herbalism. We've got an amazing midwife. She's in America practicing illegally because she's not allowed to do what she's doing out there. She's the best midwives I've ever met. And the wisdom that comes out of this woman is second to none. So that, in a nutshell, is why I do what I do. I'm passionate about choice. Kind of, they get pregnant, they fall into the system. They're all happy, healthy, and they leave downtrodden and traumatized, and they think their bodies failed them. I don't often think that the cascade of interventions, which were more often than not unnecessary, caused their trauma. And then, like I said, you end up with some sort of Stockholm syndrome. But, you saved me. But they started it. I can tell you more about that maybe a bit later, like a introduction. But I'm trying to answer your question as quickly as I can.
Yeah, that gives us a good overview. What was quite interesting, there's a few things that really kind of stuck out to me. One is ancient wisdom. So, it was your grandmother that kind of started you in terms of, going down that road of understanding more information, so to speak. And it's interesting, if you look back at history, it was, going back a long way, when the parents went out hunting and gathering, it was the grandparents that actually raised the children, right? So, we get a lot of wisdom, or at least we should get a lot of wisdom from grandparents, but I think maybe the system we live in these days has probably put an end to that. But then you mentioned, the Mayan culture, and how, again, there was more ancient information that you learned from. And it's kind of interesting that it's almost, in the last four years, crazy years, has almost highlighted the overreach of the system, or the systems, I would say, because it's not just the health, or so-called health system. I mean, we don't have a health system, right? We have a disease maintenance system. But it's quite interesting how, the last 4 years is almost a microcosm of what's been going on for a very long time. And that includes, the way that women have been led down a path to, well, this is the way that you have babies, rather than, as you say, it should be about personal choice. And it's not, there's not just one way. It's, it's going to be different for every woman, right?
Sure. What surprises me, there's a lot of people inside the freedom movement that are really taking control of their health now, but birth seems to bypass them. But you don't want, you don't know.
Mm.
If you assume birth is a medical pathologized procedure, then yeah, you'll hand it over.
Mm.
You just don't know what you don't know. Babies are made in love and should be born in love, but our children are being born into a sea of cortisol and adrenaline rather than oxytocin. And there's so much fear. Everything is fear, 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 and more fear. And that the system is based around fear of litigation, fear of getting it wrong. But, no matter what system you're looking at, it all starts, the grassroots issue is all the same. We have forgotten who we are at our core, our authenticity, our divine connection with ourselves, and that we're all one. But we have this separation. We think we're separate from each other. Yeah, I know we're in different bodies, but we're one consciousness.
Yeah.
And it just perpetuates this, the cognitive dissonance, the separation. The powers that be must be laughing because we're all amongst each other. They don't need to do anything.
Yeah.
We're just shouting at each other, but we're all connected. We just need to have an open dialogue.
Yeah. Yeah. I mean, it also goes back to the fact that, and again, this is something that the last 4 years really illustrated, in a big way, is that we just give our powers over to whoever we think the authority figure is. And in this case, it's medical staff. And it's like, tell me what to do, rather than, actually taking your own responsibility. And, and when you get pregnant, it's like, okay, so let me look into this myself. Let me ask wise people. It's like, oh, no, forget about that. When it gets to the time, I'm just going to have this, let's call it godlike figure is going to tell me how it goes. Right. And that's exactly what we've experienced over the last 4 years, isn't it? Right. It's like, oh, please tell me what I need to do to be safe. Right. Rather than actually, let me look into this because I can smell a rat,
Yeah. And that's the thing. We're separated from our intuition. We're in our ego, our structure of thought that, it makes us feel that we are important, that just the thought structure, this means that means this. And we don't have this connection. I always say, intelligence without wisdom is really dangerous to bring the two together. You can ask questions, ladies. You can ask, did you know maternity care is only 8% evidence-based? That's not good enough. So when you're being told you must have a C-section, you must be induced, what evidence is that based on? And then go down to another level, look at the actual evidence, read the studies, because if we're trying to understand physiological birth, but we're doing so by observing women in a hospital environment, how's that conducive to a physiological birth?
Yeah.
It doesn't make any sense. I think women don't understand their bodies because they don't learn about pregnancy until they become pregnant. And then often it's very, very, very much too late because they feel bombarded with information or scared. So they just hand it over. I mean, it's a perfect paradigm, isn't it? If you're a sociopath.
Yeah. Yeah.
We'll just do what we want. But there is such thing as obstetric rape. Women experience it all the time. Just look at vaginal exams. Women have actually grown to believe that it's acceptable for a stranger to put their hands inside of you during labour. Why? Why? Your cervix isn't a crystal ball. It's not going to tell the midwife where you are you're going to be in 6 hours or even 10 minutes. It can introduce infection. It can make you feel wildly uncomfortable. It can release adrenaline, which will then stop your production of oxytocin, which facilitates your birth. Our bodies work beautifully. If we were, alive thousands of years ago and we're hunter-gatherers and we're about to go into labour, but we see a predator on the terrain, Your eyes see it, and there's a process in the body that goes, that thing is going to eat you. Don't go into labor, release adrenaline. And that's going to help you fight, lie, or freeze. So you stop producing oxytocin, the very hormone you need to facilitate your birth. So what's the modern day equivalent of that? What stimulates adrenaline? Bright lights, feelings of being observed, beeping machines, hearing other women give birth, strangers putting their fingers inside of you. It's not conducive to a physiological birth. If you were having sex and you're releasing oxytocin as you do in sex, and you're in the most beautiful embrace with your partner, and then some moron smashes open the door, turns the lights on, stares at you and says, "You're right. I'm just going to put this monitor on you." Do you think you'd be able to get back into that mindset again? Hell no. And then they have this awful phrase called failure to progress. Well, yeah. Your privacy's been invaded. It's a very personal, sacred moment.
Yeah. I suppose the other I know I don't want to get into it too much, but obviously the other side of it is, the worse an outcome for the mother and the baby, the more money that produces for certain industries as well, which I don't really want to go down that rabbit hole, but it is absolutely true as well, right?
Well, the Care Commissioners Group pay the NHS nearly $4,000 for every emergency C-section. So, I mean, that's another rabbit hole to go down.
Yeah.
But let's just stick with the basics here. I mean, like, take induction, for example. They'll say you need to come in for an induction because you're overdue. I mean, I'll talk about that another time. Overdue is nonsense. And if you're watching and you want to learn more about that, buy a book called In Your Own Time by Sarah Wickham. So they'll say, come in for an induction, and you think, yeah, sure. Because they'll say stuff to you like, if you go over 41 weeks, your chances of stillbirth double. That's really scary hearing that, isn't it? But double of what, mate? Is it 1 in 5 to 2 in 5, or 1 in 500 to 2 in 500? Because the numbers matter. So language is really important. You're allowed to ask for evidence to back up what they're saying. So you come in for your induction because you think, oh, I don't want anything to happen to my baby. I'll hand over to them as ever. And then there are a few methods of induction, but 9 times out of 10, women will end up with a drug on a drip called syntocinon. If you're watching this in the States, it's called Pitocin. And it's a synthetic form of oxytocin, but it doesn't work like natural oxytocin. It doesn't go to your brain. You don't get that euphoric birth bubble. But what it does do is just smashes your uterus over and over and over again with these overwhelmingly strong contractions. So understandably, the woman will ask for an epidural. No one ever asks what's in an epidural. It's part bupivacaine, part fentanyl. And then they're rendered on their back, so they're pushing uphill. Baby can't come down, so it immobilizes them. They're not feeling the extra pain of the contractions from the syntocinon because they're numb. And then the epidural slows it down, so then they up the synto. And during this time, because your uterus has been overstimulated so much, the baby's oxygen levels are compromised from the placenta. So then baby goes into distress. You have an emergency C-section or a ventouse or a forceps delivery. And then you think, oh, they saved me. But this started that without any informed consent. Look, I'm not saying never be induced. I'm not saying that at all. And in fact, yeah, I'm sure you can understand that I love home birth and that's my thing, but that doesn't mean it's everyone's thing. Not everyone's there on the journey. I really advocate for choice and informed consent. If women were actually given the true statistics, what percentage of inductions end up with an emergency cesarean section? What percentage of babies end up in the neonatal intensive care unit after an induction? And what is my actual true risk? You know, the word risk that's my head in. Like, oh, you're over 5, you're a geriatric mother, so you're at risk. A risk of what? Based on, I know 21-year-olds who are much more unhealthy. They stuff their face with junk food. And I know 42-year-olds who are abundantly healthy. You know, they eat the right foods. They might be into yoga, meditation. So how is that 42-year-old more high risk than the 21-year-old who lives on McDonald's?
Yeah. Yeah, one of the things I know, Nathan Riley, friend of this podcast, talks about quite a bit himself is how, the training that some people get to help with breech babies. And his concern is that knowledge of actually enabling a breech birth is actually being lost. I don't know if you've got any views on that. Catherine had always been fit and active when she suffered a debilitating back injury. She was barely able to get out of bed or walk without being in excruciating pain. She visited her GP, who prescribed anti-inflammatories, painkillers, and muscle relaxants, and also referred her to an orthopaedic consultant. Catherine was bedridden for 10 days and subsequently could only get through the day with large doses of the prescribed pills. Catherine was diagnosed with a prolapsed disc at L3-4, and she was offered anaesthetic injections or spinal surgery. She was horrified and concerned that she would have constant back problems for the rest of her life. Catherine was miserable, could hardly drive, a day at work was agony, and any movements in bed were very painful. I carried out detailed postural assessments, muscle strength tests, and analysis of her movement patterns. I identified the biomechanical problems and prescribed a very specific exercise program to correct her posture, reduce her level of pain, and to prevent the injury reoccurring. After 5 weeks on the program, the pain had reduced hugely in her back, and Catherine stopped taking painkillers. After 10 weeks, Catherine was back jogging and doing more intensive exercise with absolutely no back pain, and she was so pleased that she was able to pick up her young son again. If you're suffering like Catherine was, and you'd like to find out more about getting to the root cause of your back pain, go to www.bodycheck.co.uk and request a consultation. Now, back to the podcast.
Oh, I have a lot of views on that. Yeah, the art of breech has been lost. So in the UK, midwives are trained in breech during their studies when they're at university, but they never get to practice that art because if a woman in the system is diagnosed with a breech baby, they go straight from midwifery-led care to obstetric-led care, and they're in for a C-section 9 times out of 10. So how can midwives learn the art of breech? It doesn't happen. There are a few people around that teach it and they do a really good job. There's Sean Walker. She's amazing. Then there's Breech Without Borders as well. There's some fantastic resources out there. But women just being told that breech means bad, it's a variation of normal. And while there is an added increased risk of infant mortality with a breech birth, it's the same across the board, whether it's a C-section or vaginal delivery. We don't know why that is, but the reason sections started to happen with a breech baby was it was based on the Hannah trial, which was redacted because they decided that the evidence wasn't strong enough. And the problem you see with breech birth now, if you're lucky enough to be offered a breech birth, you'll be offered it in a labour ward with an obstetrician who 9 times out of 10 doesn't understand the difference between a physiological upright breech birth, pathologized birth. And that's where it goes wrong. When you medicalise birth without the need to medicalise it, you interfere with the process. There's a saying in the breech world called hands off that breech, and it's there for a reason. But people are so frightened.
Mm. Yeah, I suppose that's another rabbit hole we could potentially go down.
Oh, do loads of sections of this podcast.
Yeah. But moving on, can you explain the ways in which childbirth trauma can impact health?
Yeah. Well, on an emotional level, as I said earlier, women will often leave their birth experience under the misapprehension that their bodies have failed them, when the system has failed them. Now, I believe in a mind-body-soul connection to understand dis-ease. So that trauma manifests often in the body. So let's say, for example, a woman has had an episiotomy. So she's had her perineum snipped, mutilated, if you will. What that does to the center of your body, there's an amazing woman called Charlie Speller, and she teaches you all about the scars, the C-section scars, episiotomy scars, and how it affects the midline of your body. Imagine the scar being a knot, starts to pull down your pelvis. You can end up with prolapses, all sorts of things. Then you've got the emotional response to the physical response, which is, oh my God, my body's awful. What's going on here? Oh my God, my body's failed me. I'm not bonding with my baby. I'm so full of cortisol and adrenaline, I can't produce any breast milk. I've got so much pressure from people around me. No one's listening to me. No one's supporting me. People are saying stupid, bloody things like, at least you've got a healthy baby. No. And I'm not saying that doesn't matter. Of course it does. That's a given. But what about that woman's experience? What about her rite of passage? What about the baby's rite of passage? What about that baby's right to have a calm, peaceful, beautiful entrance into this world, instead of strangers with masks staring at it with gloves on, pulling it out with so much aggression, and then sucking stuff out of the baby when it could just go to the mother's chest and the baby can come to gently. This is not a good start to life. And then the trauma can often build up. I know women who have got postnatal depression 10, 20 years in, because at some point they may logically forget what the trauma was, but your body remembers. And if those watching are familiar with understanding chakras, where does that sort of trauma manifest in the body? In the root chakra. You don't feel safe, you don't feel grounded, you don't feel rooted. And then if your body's giving you enough clues and you don't listen, you don't address that trauma, that wound, it will start to present itself in other ways. Bowel problems, more uterine fibroids, all these sorts of things that will manifest. It has a huge knock-on effect. And then women end up feeling gaslighted, maybe from their partners. Oh, there's nothing wrong with you. Carry on. At least you got a healthy baby. But I don't think people understand the spiritual implications here. We almost have like a malignancy in the way we treat our women in childbirth. And then we wonder why we're bitches to each other. It has a huge impact on health. But then it starts right before pregnancy. Like, babies are born with all these forever chemicals, these toxins, because of the shit in our food. And like, my understanding of health is this: there's only 3 things that cause dis-ease. And that's toxicity, deprivation, and trauma on a level of mind and body. So before a woman becomes pregnant, I would always urge them to detox, to try and get rid of those toxins that shouldn't be there. Make sure your body's at optimal health. On an emotional level, what trauma is there? What do you need to overcome? What core wounds do you need to heal before you go from maidenhood to motherhood? And the issue is, when you go through pregnancy, you don't realize the importance of nutrition. You will just go and eat whatever you want because you've got a 10-minute consultation with a midwife who's sitting there looking at a form, ticking off boxes. Any mental health issues? Anyone in prison? Do you know about nutrition? Yeah. And that's good enough. But the midwives aren't trained in it. They don't understand the importance of protein in pregnancy. This could save millions. Not just in pounds sterling. It can save millions of women from things like preeclampsia, placental abruption, gestational diabetes. The list goes on. When you're pregnant, your body has to expand blood volume by up to 60%. In order to do that, your liver has to perform 500 metabolic functions. In order to do that, you need at least 100 grams of protein a day. Your liver needs to produce something called albumin. It's like egg white. Let's take preeclampsia, for example. If your blood volume is not expanding correctly, your body thinks it's hemorrhaging. So it starts to draw the water out the cells. What happens when we hold water? Blood pressure goes up. And then you end up with preeclampsia. But instead they say, well, you got preeclampsia, you're going to have to be induced. What about right back at the booking appointment, make sure you eat the brewer's diet, which is a high protein diet invented by Tom Brewer, Dr. Tom Brewer. It's amazing. It can prevent all sorts of ailments. And if women just knew that, and it's more complicated than that. I'm not saying it's that black and white. Like, it can help prevent placental abruption, where the placenta separates before the baby's born, which is incredibly dangerous. But just knowing about protein in pregnancy can prevent something like preeclampsia. There's other things as well that aren't looked into. Like, does a woman suffer with sleep apnea? Because if they do, well, how much oxygen do you think you're going to be getting to your baby with the placenta? There's so many, but it's so black and white and linear in the system. It's not individualized care.
Yeah, I mean, you said that midwives don't get taught in nutrition. I don't think anyone in the medical field gets taught in nutrition.
No, not at all.
And again, I'm not trying to bash any profession, but even, if you go to a dietitian in the NHS, they're teaching you the very thing that was warned would cause an epidemic in obesity and diabetes in the 1980s. But the American government went along with that. And then, of course, every other government followed it. And that was what was called the food guide pyramid. Right. And they still follow that, even though it has caused one of the biggest health problems human beings have ever seen. And yet that's what they still teach.
Yeah, it's quite alarming. It's really alarming. There's anyone watching that's interested to really understand nutrition, I always recommend the Big Fat Challenge. It's fantastic. Just go to their website. In fact, you should interview, if you haven't already, Phil Escott.
Okay.
From the Big Fat Challenge. And he wrote a book called Arthritis, the Best Thing That Ever Happened to Me. So he cured everything just through understanding nutrition. But it's alarming. I mean, there was a friend of mine, she wasn't quite on the same page as me with her first baby. But with the second one, she kind of said, all right, Stark, let's do it your way. And she rang me once and she goes, I nearly fainted. And long story short, I discovered she had gestational diabetes. I'm like, what have you been eating? She went, oh, cake. I went, oh, that'll do it. So she went straight on the brewer's diet. And within 10 days, gone. No sign of it. It's incredible. If you just understand a little bit of nutrition, it will be so empowering to help prevent all sorts of things. And you need to understand the impact of the gut health, the human microbiome in your baby through the method of birth, how to help afterwards if maybe you needed a C-section. So how a baby is born does matter when it comes to the microbiome. I'm sure you've already discussed this. So maybe we don't need to go into that.
Well, yeah, I mean, some people might not have heard other episodes where I've covered that. But obviously, I actually had a guy called Stephen Lawrence on the show who produced a film called Invisible Extinction, and it was all about the gut microbiome. And, they were saying, look, if you have a C-section, what you can actually do is you can actually swab, from the mother's vagina and actually swab around the baby's nose and mouth to, inoculate the baby that didn't come through the birth canal.
Yeah. And you can use skin to skin straight away. That's really good for the microbiome seeding, and obviously breast milk. Milk is, it's just liquid gold. Can't stress it enough, but there's no support.
Yeah.
Women are told, I wasn't able to breastfeed. Well, the reason you weren't able to breastfeed is because you got no bloody support. A lot of pressure. It's a physiological process. No one needs to be taught how to go for a wee or a poo. And you know what? I always say this to women if they're scared about giving birth. If you're in a coma, your head doesn't need any input. You just give birth because it is a physiological process. At no point in your pregnancy do you stop to think, how do I grow the baby's kidneys? It just does it. And your body will just produce milk. But sometimes we get in our own way. And it's not a blame thing. We get so much in our heads through so much external fear. So many people saying, just give her a bottle, darling. There's no comparison. And bottle-fed babies are far more likely to visit A&E within the first 2 years of life.
Yeah, that was me.
Me too. Me too. But it's not to cause shame. I think there's a lot of women that are triggered, like they might have had a C-section, they chose to bottle feed. It's not, if you've chosen that, own it. You're not shaming you. The education is for next time or to help others. and to know better, to know more. If if you've had a birth that you weren't happy with, I understand why you're triggered. You didn't know. You don't know what you don't know. I put a post up on the Instagram the other day saying breast is best, and I got slated. I'm not trying to shame anyone.
Yeah.
So, but if you want to bottle feed, bottle feed. No one's shaming. I think this is a trauma response, right? Because we're taught that our sense of validation comes externally. And people agree with what we agree. It causes us to be offended. But really, if we look at it on a deep level, if we believe we're doing our best and we are doing the best for ourselves and our babies, then what's to get offended about?
Yeah.
Own it.
Yeah. I mean, I know you can also get breastfeeding coaches now, can't you?
Yeah, doulas do that. Lactation consultants. Yeah, we teach breastfeeding in our courses. And the courses aren't just for people becoming practitioners. That we've got quite a few mums that have done the 6-week doula course just because they want to learn more and they feel so empowered. And I think the most important thing on the course is the first module, which is understanding your own trauma. Because the problem I see, not just in midwifery, everywhere, we've got people who are getting about the place who can't regulate their own emotions. They react rather than respond. Everyone's offended by everything. No one remembers who they are. They've got no connection with authenticity. And that is the last thing we want in a birthing room, someone who can't regulate themselves. So the first module is focused on understanding your own trauma, doing the inner work. Because when you do that, there's a ripple effect everywhere. It's the most empowering feeling. But just to understand so many other levels of pregnancy and birth that aren't taught in the system, and there's like no chance it will be taught either. It's very hard to come by the sort of information that I teach. It's so empowering. And when you've connected your wisdom with your intelligence, you feel very aligned, you feel you can advocate for yourself, you know what you want. Awesome. That's going to be the biggest change. When we get birth right, we'll be fine.
Yeah, I mean, another thing, talking about, bottle feeding again, if every mother breastfed, there's going to be a commercial cost to that, right? Because the companies making all the formula and the bottles and everything, the plastic bottles, they're without a doubt harming the babies as well. Drinking warm fluid from a plastic bottle is not a good idea.
Yeah, what's that plastic toxin called? Is it called phthalate?
Phthalates, yeah.
Yeah.
Well, there's lots of others as well, but so you don't breastfeed for whatever reason, the child has a less than optimal gut microbiome, and now they're more likely to get illnesses as they're growing up. And then what do? They take the kid to the doctor, and what does the doctor do? Put them on medication. It's a big business to not have a healthy childbirth, right?
It's a huge business. And then mums who have got postnatal depression, what medication are they going to put them on and tell them they're crazy? Do you know the number one cause of maternal death? Suicide.
Wow.
Suicide after birth. And they only looked at that in the first 2 years. They didn't extend that study to any longer. Disgusting.
Yeah.
Women feel there's just so much trauma. There's so much trauma stored in our lineage. And but you know what? I'm more about creating rather than criticizing, because I don't think we can't fix anything from the same level of energy that created the problem in the first place.
Yeah, for sure.
So I think it's about coming into your body, the somatic approach, right? So where in your body are you feeling this trauma? What can you name the emotion? Can you sit with it, with how uncomfortable it is? What can you do about it next? Can you surrender that? Can you cut that trauma? There's a lot of work to be done. There's a lot of work. And we do help with this. That when push comes to shove, I do coaching to unpack all this, because it's a fundamental part of birth. Because we're repeating the same generational trauma over and over.
Yeah.
But as the saying goes, peace on earth begins at birth. And I really, really believe that.
Yeah, I like that. So you mentioned a little bit about, when push comes to shove earlier. Is there any more you wanted to say on that? Amina was a 32-year-old personal trainer and mother of 3 when she came to see me. Amina, whilst training to run a marathon, experienced lower back pain and sciatica. Amina's back pain meant that she couldn't run without pain and had completed her last marathon in a disappointing time for her. Amina wanted to complete a half marathon in under 1 hour 50 minutes, eliminate her back pain, and get back to running full distance marathons. I devised a corrective exercise program for Amina to realign her postural imbalances and help improve her stability, which she completed for 30 minutes a day, 5 days a week. After working with me for a few months, Amina completed a half marathon in 1 hour 45 minutes, beating her target time by 5 minutes, and now she has no lower back pain or sciatica. Amina has since gone on to complete several full-distance marathons, finishing with good times. If you'd like to achieve similar results to Amina, you can contact me at www.bodycheck.co.uk to secure your consultation. Now, back to the podcast.
Just whoever's watching, tell people about it. If you might have a niece that's pregnant, or a daughter, or a friend of the family. There is another way. I'm not interested in a dogmatic approach. I'm not interested in making everyone have a home birth, because it's not everyone's journey. That's not empowering. And there's already a system that tells you what to do. I'm not getting involved in that. All I'd like to do is signpost you so you can optimize your health, your pregnancy, empower yourself, advocate for yourself. We have a directory of birth keepers and doulas that are now in 10 countries. So if you feel that you maybe want a little toe in the system, but you would like natural support from our birth keepers, we don't offer any clinical care. Come to us. If you want to train, come to us. And we've got Telegram called Awaken Pregnancy and Birth. I'm on YouTube. I'm on Instagram when push comes to shove. We've got little courses, a free birth preparation course, which is if you want to free birth, which means no medical assistance. But again, it's not about dogma. And we've got this obsession of, as humans, of black and white. It's a very 3D way of thinking. But there's so many layers. Everyone's on a different journey. Home birth is not going to be right for everyone. And if that's the case, you can still come to us, because we will help you advocate for yourself and navigate the system.
Yeah.
We are specialists in human rights in birth. So if you're being told you're not allowed to do this, you're not allowed to do that, nuh-uh. You can do what you want.
Yeah.
Your choice. And if you need help knowing how to word things, emails to consultants, etc., please get in touch. We're just here to talk about choice and empowering women so they can actually remember who they are, connect with their inner wisdom, and let's hope we can break this generational trauma.
Yeah. Just want to move on just a little bit. So, as I think I deal with a lot of clients who are in chronic pain, and some of those are females, and some of those females have had children. But how can, in your opinion, an over-medicalised childbirth cause chronic pain?
Well, again, it will go back to the mind-body connection. So chronic pain it's very common in cesarean section scars, adhesions on the scars. Speaking of chronic pain in other ways, I have seen women go into psychosis, into moments where their labour has repeated on them. They're feeling it again. I've actually had to call an ambulance for someone. I thought, oh my God, she looks like she's in labour. But she'd had a C-section and her body was reliving it. She couldn't come to the conclusion in her mind that her body did not get to complete the process. You can have, if you're giving birth on your back and you've had a ventouse extraction, so they suck the baby out, or forceps, this can really damage your pelvic floor. From the episiotomy, where they cut you, if you are laying down giving birth and you're pushing uphill, that is not conducive to how physiology works within the vulva. You need gravity to bring it down, and you don't need coach pushing unless you've got an epidural and you physically can't feel to push. You don't need a midwife shouting at you to push. Imagine if someone was shouting at you to throw up when you're vomiting. How helpful is that? Yeah, this, don't worry. Your body just takes over. But when they're saying, right, stop pushing or carry on pushing, your body, you need to listen to your body, not someone's opinion. Listen to your body. Your body's not going to lie to you. So you've felt all this pressure from midwives or obstetricians. You're pushing uphill and you tear. The amount of women I see, and I suffered with this with myself as a 21-year-old, who end up with rectocils. So a prolapse back passage, or cystocils, prolapse bladder. And they're so embarrassed, they don't talk about it. So years later, they're struggling to go to the toilet. They don't know why. They feel so shameful that something isn't working. This shouldn't be happening. After a normal, physiological, calm, quiet, gentle birth, no one should be sitting there talking about a prolapse. And then we normalize incontinence. So you see on TV these, I don't know if I can say the brand, I probably can't. The pads that women wear for incontinence. You've got these women in their 60s looking really happy with themselves. Don't worry about a bit of leakage because I've got a pad. Why you got leakage? Shouldn't be having a leakage. Childbirth doesn't inherently cause that. Over-medicalised traumatic childbirth does. And then you can, I had for years, I couldn't work out what it was until I was living with my friend and she spotted what was going on. Every so often, I would be in excruciating pain. This was after my first pathologized birth. I was in so much pain, I even had friends call an ambulance for me several times. I couldn't explain. It was like a dragging feeling, like my insides were coming out. And they just said, oh, we don't really know why that's happening. So they didn't really look. They didn't understand it. They didn't do any tests. And my friend said to me, I figured out the pattern. It's when you ovulate. I'm like, oh. And she said, you must be very inflamed when you ovulate, and it can affect the rectocil, the prolapse you've got. She was right. And that went on for years. Women in older women, like if you've spoke to them back in the 80s, 70s, they would shove potatoes up there to keep everything back because they didn't want to talk about it.
Wow.
But there are natural remedies. You could take pulsatilla. If you understand, I spoke to a homeopathy expert and she said, what time do you get your pain? And it blew my mind. I was like, I don't know, about 11 p.m. It's always at night. She went, what time was your baby born? I went, oh my God, it's 20 past 11. She went, your body remembers. And that just blew my mind. I thought a lot of this is psychosomatic. I know that. I can help. I can help my body heal. There are endless manifestations of pain after birth. Emotional, physical. Scars can be so painful, itchy. You can have chronic pain in the vagina for you can't have sex afterwards because they've sutured you up too tight, or you've got all this scar tissue. That's another thing. You don't have to have sutures if you've torn. Your body will heal naturally. I'm not talking like a 4th degree tear, like a 1st degree tear. You can do is you can say that's the wound. You can pack it with a bit of dulce seaweed and put some manuka honey over the top. That will heal within 24 hours. There's loads of amazing things you can do. Sitz baths, yoni steaming, or just leave it. But women think, I have to have stitches. Do you have to have stitches? Or is that the only option you've been given? There's a difference.
Yeah, I had a doctor Ariel Martone on the show a month ago, and we were talking about postpartum pain. And from my perspective, one of the key things is, well, there's a number of key things, but obviously there's postural changes during pregnancy, which puts, let's just say, abnormal load through the spine and the pelvis. Obviously, the ligaments they soften during pregnancy to allow childbirth, and then you've got trauma potentially, and then natural trauma, but then you've also got potentially being cut as well. So then you've got scars. So from my perspective, what I see is a lot of women, they go through childbirth, and yes, if they went through a perfectly physiological birth, as you talk about, yeah, chances are, as long as they're leading a normal life afterwards, they would probably just rehabilitate normally.
Yeah, but there's another problem. Our postnatal recovery. We do not respect it. Women are expected to get up really quickly, start with all the housework, start with going back to work. No, you should be looked after for the first 3 months. You shouldn't be doing anything. And then we worry, because your body has just been through a huge, huge ordeal. Even if it's a nice natural birth, you have to recover. But we've got this expectation, well, if I don't do this, this will happen. We micromanage everything in our heads, and we think if we relax for 2 weeks, that the world's going to fall apart. No, if you want to have a beautiful postnatal honeymoon, get naked, get the baby naked, get in bed, breastfeed, and enjoy. You'll never get it back. You don't need to be going out there and entertaining people. You don't need people coming over and looking at your baby. It's your choice. There's a great book by Dr. Sophie Messenger, Why Postnatal Recovery Matters. We include it in our courses. It's so beautiful. Different cultures, we can learn a lot from different cultures about sitting the month in Asian culture. Shouldn't be lifting a finger. Many women end up with SPD, symphysis pubis dysfunction. Sometimes they now call it pelvic girdle pain. As you were alluding to earlier, when you're pregnant, you release all these hormones, relaxin, to help your joints and ligaments soften. Sometimes you release too much, and then your pelvic girdle ends up rubbing together like this, and you get all this pain in your pelvis and your hips. Sometimes it takes months, if not years, after the pregnancy to go back. But again, that could be remedied simply by understanding nutrition and understanding to listen to your body.
Yeah, one of the things that I discussed with Ariel Martone was that, actually a lot of women, particularly if they've gone through more traumatic type births, they actually need rehabilitation, right? Like, and when it comes to scars, scars actually cause feedback to the nervous system, just like pain would. Think of it as exactly the same thing. So it's feeding back to the brain that there's damage at that particular site. Well, what the brain does, it actually sends signals back to the same levels of the spinal cord, so the same levels of the nerves at the spinal cord. And what that tends to do is it tends to inhibit slow twitch muscle fibers. Now, slow twitch muscle fibers are the ones that keep your joints nice and stable. So if you've just had a baby and perhaps you've got scar tissue, or you don't even need scar tissue as well, those muscles are still going to be inhibited because they've been massively stretched, right, for 9 months. So if you then go back to normal duties, your joints don't have the normal level of stability they would normally have. So really they're exposed. But I guess the issue that we have in modern society is, you've got to get back to work, right? A lot of mothers go back to work, don't they? And it's almost like there's a financial incentive to get back to work, rather than actually my baby's the most important thing, and so is my recovery. For a lot of people, they're in a situation where they probably don't even have the option to not go back to work. But from my perspective, in a lot of instances, there is a lot you can do from a physical level to speed up the process of rehabilitation as well.
For sure. That's so important as well to understand that. You should interview Charlie Speller. You'd love her. She came and did a talk at When Push Comes to Shove recently about scars and everything you just mentioned. It's incredible. But I think we need to just love ourselves a bit more. Okay? To remember who we are. We need to remember that birth is a beautiful, euphoric experience. It's not like a natural process that happens occasionally if you're lucky. That's the norm. Saying birth is inherently safe. It's not, but it's certainly not inherently dangerous. Don't let anyone tell you otherwise. It's not. Get the argument all the time, well, women used to die all the time in childbirth. Yeah, they still do, for the same reasons. Poverty being number one. You know, if you're living in an overcrowded environment where disease can spread like wildfire, and malnourished, that's a recipe for disaster. If you've got a physical ailment, you've been, I don't know, in a car accident, you've got a mechanical problem with your pelvis, that's another reason why birth can go wrong. But the most common reason, in my experience, birth going wrong is over-medicalisation of birth. If you just look at the When Push Comes to Shove statistics, we know that there's nothing wrong with the pelvis of a woman of 2024. So the national average of home birth rate in this country is just under 2%. Ours is 77%. The C-section rate is approaching 45%. Although if you look it up, you'll get a different number. But follow a lady on Instagram called Kemi Birth Joy Johnson. She does all the hospital infographics and breaks down the true statistics. Our C-section rate at When Push Comes to Shove is 9%. And we want to get that lower. So there's nothing wrong with women's bodies.
Yeah.
There's a lot wrong with the support.
Yeah. Yeah. I mean, I would kind of go back a little bit to what you said earlier as well, is, you know, even if you're thinking of conceiving, you know, prior to that, you've got to start thinking about getting yourself as healthy as possible.
A year before.
Yeah. Yeah. I mean, if someone comes to me and they say we're looking to get pregnant, it depends on how they present at the beginning. But quite often, for most people, I'll say 18 months to 2 years to get, you know, optimum health in order for you to have, you know, the most healthy child that you can have. And that's mainly because of the way we live life today. You know, as you mentioned, the nutrition's poor, our water quality is poor. Most people don't exercise correctly. You know, even if they do exercise, most people get to bed too late. Most people are full of toxins, right? Most people have got emotional stress, mental stress, possibly spiritual stress as well. And then people think that they can give birth to a healthy child, which, you know, I would suggest is quite a challenge if you've got all those problems going on.
Yeah. Or you've got a dopamine issue where you're scrolling through Instagram all day. We haven't addressed your own trauma and you're reacting rather than responding.
Yeah.
You know, there's so many layers. Absolutely. But ultimately, it's down to the individual to govern their own path. So no one should be bombarded with information. You have to do this and you have to do that. What's right for you? I don't begrudge my first birth. It was a huge learning experience. Oh, that's what you do if you hand yourself over to other people. Okay.
Yeah.
It was a really, really therapeutic experience for me. To be so traumatized was therapeutic, I believe. But it made me remember who I was.
Yeah. Yeah, moments like that in some ways are blessings, aren't they? Because, you know, they're enabling you to learn and grow, and then you can use that learning to help others.
Exactly.
You know, that's what we call the hero's journey, right?
For sure. I love it. I love what I do. I feel it's my human duty.
Yeah, for sure. So I know we need to wrap up. Any kind of final words from you?
Just don't let anyone tell you what to do. Do your own research. Become empowered. Remember who you are. I can't say that enough. Not here, not the story your mind has told you what you are, about the job you do or how many kids you have or your status in life. Here, remember here, your authenticity. Drop into trust. and align with who you really are. And then learn about your birth education so you can become armed with knowledge and you won't have to battle the system. But if you have any questions at all, please get in touch when push comes to shove.credit.uk. Thank you.
Awesome. So I was literally about to ask you where people can find you online. So you mentioned that website, but you've got more details, right, where people can contact you online?
Sure, yeah. We've got Instagram, which is when.pushcomestosshove. Well, in fact, go to the website and press contact and all the little social media buttons are there. Easy peasy.
I'll put all the links in the show notes anyway.
Okay, thank you.
Nickita, thank you so much. This has been a really enjoyable and interesting and important conversation. And, I guess you'd probably join me in saying, if this helps at least one woman, it's been worth the time.
Oh, 100%. And thank you so much for giving me your time to talk about such an important topic. Thank you.
My pleasure. So that's all from Nickita and me for this week. But don't forget, you can join me at the same time, same place next week on the Radical Health Rebel podcast. Thanks for tuning in. Remember to give the show a rating and a review, and I'll see you next time.